the last training, you learned about activities of daily living and what to look for when something may be changing with your loved one. This module picks up right where that one left off. Because once you've noticed something, once that feeling of something isn't quite right kicks in, the next question is often, what do I do about it? That's exactly what this training module is here to answer. Here's something important to understand. Your job as a caregiver is not to figure out what's wrong. It's not to diagnose, it's not to be 100% certain before you act. Your job is to notice and say something. The care team figures out the rest. That's what they're there for. And here's why this matters. The biggest mistake caregivers often make is waiting too long, hoping an issue they notice gets better on its own, or not wanting to bother anyone, or feeling like they need to be sure before they pick up the phone. Research consistently shows that catching changes early, before they become crises, is the most effective way to prevent an ER visit or a hospital admission. And you are often the first person to notice because you know your loved one better than anyone. So what are you looking for? Not symptoms, not a diagnosis. You're looking for behaviors that are different than usual.
What to watch for: shortness of breath or breathing that looks different than usual, confusion or a sense that their thinking seems cloudier than normal, new or increased pain, or behaviors that suggest they're uncomfortable, not eating or drinking like they normally do, a fall, even if they say they're fine, even sliding to the floor or stumbling into a wall counts, changes in how they're moving, their energy, or their skin, medication issues, missed doses, confusion about what to take, anything that makes you think this isn't like them.
None of these mean something is definitely wrong, but all of them are worth a phone call. You don't need to know what it means. That's what your licensed care team is for. Recognizing these changes means you should already have a clear idea of what normal or usual means for the person you care for. For instance, if they normally eat half a sandwich and some apple slices for lunch, that might not seem like a lot to you, but it's what satisfies them. If one day they only take 2 bites of the sandwich and leave the apple slices, that's worth noting and sharing with your care navigator. You've probably heard this before: if you see something, say something. That holds true for family caregivers. That early observation is exactly what your care team depends on you for.